so excited to bring you our very first Ask the Expert. We had a lovely opportunity to chat with Angela from Active Motherhood, and let me just say, we learned so much from her. Angela is an expert in pelvic floor physical therapy, helping moms combat pelvic floor dysfunction such as prolapse, pain, bladder control problems, and more. We wanted to bring in an expert early on in our Ask the Expert series that could help serve moms in our community. And we thought, really, who better to serve moms than a pelvic floor PT? Angela is a mom of 3, a doctor of orthopedic and pelvic floor physical therapy. She is also a wife, a triathlete, and an avid runner. She's very, very impressive. She's a former collegiate athlete who also struggled with pelvic floor dysfunction before and after becoming a mom. So she has firsthand experience with the frustrations that these things can bring to life. She's passionate about meeting moms where they are and helping them become pain-free while also teaching them how to move their bodies because motherhood is active. So we invite you to take a listen to our conversation to learn all about the pelvic floor. Here's some real life examples of how her expertise can help, and enjoy the camaraderie that we feel as allied health professionals working to make the world a more accessible and informative place for moms and their families.
And I do have my pelvis here if you guys want to see what that, but
yeah, show us where the pelvic floor is.
For sure. Okay, so this is your pelvis. Okay, this is your pubic bone in the front. These are your hips. I know that but just if anybody else is watching this,
you're good. It's fine.
Your spine in the back. Okay, and so I'm going to flip it, not to get dizzy, but I'm going to flip it upside down here. Okay, so this now diamond. I like for people to know that one of the things it's super helpful for people to know is that your pelvic floor forms this diamond shape. Pubic bone, sit bones, your butt bones, and then your tailbone in the back. And sometimes I think it's a funny visual. I like to say things that are kind of in your face and funny, because then you'll remember it. So I like to reference the tailbone as a bee stinger. Okay, so
that's awesome. I've never heard that. I love that.
I know, I just make up things. And I'm like, you know what? Okay, so if you can think about your pelvic floor like a diamond, right? Okay, and so this, again, pelvis. And so if you are so your abs would be in the front here. If you are not using your abs correctly, let's say, like now you're pregnant or you're just, I overtrained my abs. I had a 6-pack, but this was in college. No. But I was not engaging them the right way. Like I was creating this bread loaf. It didn't really look like a bread loaf because I hadn't had kids yet, but if I would have continued to train that way, then it would have made a diastasis worse. Because when you're if you've ever heard the cue, which is not a good one, but if you ever heard the cue when you lay on your back to smush your back flat, when you're doing abs, it's actually what you're actually doing is putting pressure out. You're putting pressure out, which is also going to be putting pressure down, which is not a good strategy for things like prolapse and back pain. And that's a little bit of a side note, but either way. So yeah, if your abs are not working correctly, that's going to impact your pelvic floor. If you're not using your hips correctly, let's not even say that they're strong or they're weak, but let's just say they're not coordinated, which could be the same. Like if they're not coordinated, they could also be weak. But now if you're not using your hips the right way, right? Like now you have hip pain, but a lot of therapists, and even like orthopedic doctors, they'll look at just the hip, but what if it's the pelvis?
Yep.
Right? Like that's where my brain goes. And that's how people, especially when I'm working with them, like on a one-on-one capacity where it's more specialized, that's how people get fast or get better really, really quickly, is because I'm not just looking at just your hip as flexing or extending or going in or out. It's what if your hip is fine and your pelvis is all shoved, right? And now you have hip impingement, but it's not because of the hip, it's because of the pelvis. Does that make sense?
Yeah. I am hypermobile. lucky
Mhm.
me. So as I age, it's just, getting better. But I have an issue with my, I think it's a muscle in, like really deep in my back next to my spine, and it's
Right.
always my left hip that just um, like even going hiking, for example, we'll be going over a log. I can lift my right leg easily without pain and get over the log, and my left, sometimes I actually have to use my arms to help pick my left leg up to be able to get over it. So you're making me kind of go, wow, maybe it's pelvic floor that's contributing to the whole issue. Huh.
Yeah, it might not be your pelvic floor, but it could be like your pelvic floor definitely could be a player. But I would say for you, it'd probably be your hamstrings or your adductors, because then if you can't, like, if you're tipped forward, now, like, let's say that the pelvis is the roof of your hip. Yeah, this is your left hip, so it doesn't matter. But so if the pelvis is tipped forward, the roof is more exposed, we'll say. So now when you try to lift up your hip, it's going to hit. Like, bones don't like to touch each other.
Right.
So like, good, they don't like that. So you might also be grippy in the back, like a little bit grippier on your left butt. I don't know if you are or you're not.
It does hurt. Yeah.
Yeah. Okay. So a little therapy session here. So your hamstrings attach to your sit bone, your butt bone. Okay.
Mhm.
Oftentimes people with back pain or hip pain, they need more hamstrings. That when you anchor those hamstrings, it's going to pull your pelvis more neutral. You also might need more inner thigh muscle on that left side. If you tend to kind of roll, like if that left knee kind of rolls out more, just maybe because of tightness or weakness or coordination, whatever, that is also going to make this hip a little bit more shovey. So now it's like a big, angry mess. So doesn't have to be hard. That's not meaning it has to be hard, but it probably means that you need more hamstrings and more inner thigh, which the inner thigh is attached to right here. And so you need inner thighs to help support your pelvic floor. And so when I referenced the bee stinger, it's a diamond. A lot of times when people are pregnant or they have, or postpartum or just like even later in life, if you never fit, I don't like to tell people that they're postpartum forever, because I feel like I think that then it's kind of like, well, what's the point? Like if I'm postpartum forever, then like, what's
Can
the
I ever
point of you
fix it?
trying?
Yeah.
Yeah. Instead, I would say you're postpartum for like, 6 to 8 weeks, maybe 12 weeks. You can classify that, but you're a mom forever. Like, let's just say you're a mom forever and your body is resilient. So the things that you might have to work on when you're 6 to 8 weeks, 6 to 8 weeks postpartum, they might look a little bit different than if you were, let's say, 2 years postpartum or more, just because of the changes that your body will make during, like, just time, like just the healing component of like an ankle sprain, right? Like if I just had an ankle sprain, my ankle is going to be a little bit more floppy. I'm going to have to be a little bit more protective and thoughtful. If I never rehabbed from an ankle sprain, 2 years out, I might still walk goofy and I might still need to fix things, but I might be able to do it faster. I might, not have to think about the time frame of tissue healing and things like that. Does that make sense?
Mhm. Mhm.
Little side note there again. Like, but the tailbone, the bee stinger. So for people listening, don't squish your bee stinger. Don't squish your bee stinger. Keep your bee stinger, let your bee stinger be free. All right. So when you're sitting or when you're standing, basically what that means is don't clench your butt cheeks. Don't do the butt crack quarter squeeze. When you do squats at the very end, don't do the grip or the butt crack quarter squeeze where you're really like squeezing everything together to get your glutes at the top, because that is to squish your bee stinger. And that is not good. That's this. That is not good for your pelvic floor, even though it's like, let's really get those glutes. It's like, no. That's not good for your, that's not good for your back. That's not good for sciatica. That's not good for your pelvic floor, because now you're going to have kind of a saggy pelvic floor, because now it's like it's supposed to be a diamond right here. This is going to be a saggy pelvic floor. And if I have a well supported, now I have a lifted pelvic floor. Do you see that in a good way? Which is why I like to look at this stuff first and do Kegels later, because this stuff will impact and help support your pelvic floor. I like to come at it from that lens of, let's not blame the pelvic floor for problems. Instead, let's support it. And let's look at things like what you just mentioned, right? Of your hip can't really lift it. So maybe you need more inner thigh. So I'd maybe give you something like a elevated bridge with a block squeeze. There's videos in the programs for it. But make sure that you don't squeeze your butt cheeks when you do it, which is why it's really great to have something where you're squeezing, because it tells your brain. And that's where props are super helpful, where a lot of people, like when they're doing workout programs, they're like, I don't need this or that, like this modification, I can do it. Like I can make it work. Or, I'm strong enough. I don't need the support. But props, similar to when a baby is learning their development, right? Like it helps your body show up because you're telling it, like you're helping it. You're supporting your body in a way where like you're making that more successful for you, which is going to ultimately help you get to your goal faster. So, holding on to a chair when you're doing squats, like I had to hold on to a chair for probably like a good 10 weeks after having Axel, which is really, really important, because a lot of times when people do squats, they'll do these little flippity doos. Like when they get to the last end range, if you see that now you might see that.
The butt wink.
The butt wink, right?
Yeah.
But it's because you actually need to teach your body how to open up your back passage to lower in to your squat. I don't have enough hands here, but to lower into your squat. Either way, using props, holding or squeezing a block, super, super helpful for your hips, for your back, for your pelvic floor, because that's the, space that we're talking about right now. And then you maybe won't need to, but yeah, don't squish your bee stinger. Long story short, pelvic floor is a diamond.
Yeah, thank you so
stuff.
much for those two things. And just to comment, I think props are so important, especially if it's not something that we're learning new. So they're really helpful to retrain poor patterns.
Yeah.
Mm-hmm.
Yeah. So, and something, we have like in the peds PT world, like for kiddos who don't crawl, or like if they're butt scooting, or if they have like loosey-goosey hips that just like want to go everywhere. We have these little things called hip helper shorts, and they're like the worst 80s nylon colors and like fabric that you can think of, like tight gym short material, but the inseam is sewn together. So it helps to put hips into a more biomechanically sound position so that they're better able to strengthen their muscles that support their hips in that biomechanically sound position, right? So it's just so funny how, like for PT, and Rachel, I'm sure you can probably think of something to pull speech in here too, but like for PT, it doesn't matter if you're treating an adult or a child. It like the foundation of it is just all the same. Like if you've got a good practitioner who's looking at the core of the root of the problem, you're so right. You're gonna get faster results and like just improve your overall quality of life, whether it's you're just happier in tummy time because you're a 3-month-old and you don't feel like you feel better now that your reflux has been managed, or if you're, a 40-year-old who had their last kiddo 18 years ago, but they still have diastasis recti. It's all like, it just is all foundationally the same.
Ab separation, right? And that's very overlooked, even if it's a 1-finger gap, like 1-finger gap is not technically like a big deal or not, classified as severe. But it's more so about teaching your body how to communicate that left and right side. So if you were to bring it up to your provider like your medical doctor, they may or may not, probably more so not, refer you to therapy for a 1-finger gap.
Right.
Even for a 3 or 4-finger gap, like they might just say, well, now this is surgical,
Yeah.
when it doesn't even need to be, first of all. But there's just so much opportunity. And I think that, moms need to more so advocate for themselves. I've tried to talk to the providers in my area, and it's not that they don't listen, but it's also that they just have so many other things, right? Like it is hard because I really like the providers that are in my area. But they also have so many things and they're not trained in this, so
Right.
they not flagged unless it's like obvious,
Yeah. Yeah. Or
Um,
like clinically significant. I know that these days there are a lot of AI technologies that like these primary care doctors are starting to use, and they input the information. And it's not anything against the providers. It's because their patient caseloads are so massive that, these tools are being implemented to try to, like, in a sense, lighten the load a little bit. But you're so right. Like the 1-finger separation, it's not clinically significant. And so it's going to get brushed aside as like, well, cool, you're healed, or like, it's not bad enough yet.
Well, and then you have to think about like insurance too, right?
Mhm.
So if you're going to a even physical therapy practice that takes insurance, it might not be covered because it's not clinically significant. It doesn't
Right.
mean it doesn't matter. It doesn't mean you wouldn't benefit and that you won't have problems in the future if you don't have this addressed. But your insurance may not cover this
Mhm.
because it is not bad enough, unfortunately.
Yeah.
So, I mean, that is kind of the world we live in too, where I've had people denied insurance wise for childbirth prep where they would benefit, but insurance doesn't see it that way. So,
Yeah.
I think that's another benefit of seeking out other resources, right? So either going to a private practice where maybe they don't take insurance, but that's a lot of times for a reason because they've been so limited either on, if unfortunately insurance is very much like, I think peds is maybe different, maybe, but at least for like the adult side of things, it's very much like you are a shoulder, you are a
Mhm.
knee, you are an
Right.
ankle, right? You are a pelvic floor. And so for
Right.
me to look at the foot in an insurance,
Yeah, you can't unless there's a
you cannot.
CBT. Yeah, unless there's, or no,
Yeah.
excuse me, if there's an ICD-10 code
Right,
attached to it, then
right.
yeah, I
It's
I
there,
remember when I worked in orthopedics, that was it was a big
right?
problem, right? Because I had a wonderful mentor who who taught me all of these things, right? She taught me like, hey, if your patient comes in and has like a hip problem, look at the back. If they come in and they have a shoulder problem, look at the neck. Like she told me early on as a new grad PT, like it's not just
Right.
body part that the patient is referred to. And that was something that, man, all the time it was just hitting walls. And I'd be emailing doctors' offices and saying, like, hey, I know you referred this patient for this thing, but I need permission for, like, I need you to add this ICD-10 code because I want to help them with their neck, or I want to look at their foot and address like this type of mechanic. And so, yeah, the insurance game it's a tricky game to play. And I know that that's why a lot of PTs are switching to cash based.
A lot of like, because I see because of the algorithm, like I see a lot of like pelvic floor therapists and things on my Instagram. And most of them that I think are most of the ones that I like, and there's good ones and there's bad ones, and but most of them are private practice.
Mhm.
And that means that they're probably out of pocket. And they might create a super bill, but most of the time it's going to mean they're out of pocket. And that's the reason. Like it's not it's that's just the reality, and then also that it is helpful to have extra time, because
Yeah.
if I'm needing to see 20 people a day, that's maybe outrageous, but like maybe if I have to see 14 people a day, which is not outrageous, at least, I mean, it is outrageous, but
But it's
it's not,
done.
but it's,
But it's
it's,
not a McTherapy.
yeah, like that is like what the reality of it is like,
Mhm.
in a big hospital clinic outpatient system, it's usually like you're seeing 14-ish patients a day. And so it's like, it's not on the therapist either, because it's like, if you can't, it's just hard, right? Like the best would be the holistic care. But it might not be feasible, like
Right.
Well,
mentally,
and you're saying too,
for that therapist.
right. And the other barrier is you might not have, if you live in a rural area and you have a specific condition that you need a laser focus on, even though we're talking about, somebody who's able to see beyond it. But if you're not able to see the problem at first to get beyond it, to back up and get a more, a larger view of it, you're stuck in a hole too. So, I
Absolutely.
think that's where our programs with being online, we're able to, in our case with NewDay Child Coaching, is we are bringing 3 separate disciplines and weaving all the information together, and it's on demand. So you can learn all about it and how it's all integrated. And then in your case, Angela, you are not only pelvic floor, but you're looking at prolapse. You're looking at all these things that are really specific and specialized that, again, if you're in a rural area or even a really crowded area, like you're saying, the patient care, if somebody's seeing 14 people a day, okay, they might say, yeah, you need to work on your pelvic floor, but they're not really going to get to all of the things that they could if they had more time.
So kind of going off on that, I don't think what I do is rocket science. Like, I don't know if you guys feel that way. I mean, it's just a sense of, you have to know it. Like, if you don't know it, then it does feel like rocket science, but it's so easy, or I feel like it's easy to like teach a mom how to work on their own tummies or to work on their own, like, and I think it's more powerful when you know how to do your own like PT techniques, and you know how to apply them when you need them versus like, well, I don't have my appointment for 2 weeks and I'm, like, give you the tools. And so I try to teach that in my programs and try to teach strategies, because you're not going to know all the strategies, but like, let's give you a lot of tools.
Yeah.
Well, and Angela, what I love about that too is that you're doing that, it's on demand, right? And so it's kind of like what we're doing as well. So we're creating content that will be, week by week. So each week of the month, or I'm sorry, yeah, each week of the month, whatever day you want to do it, hop on and learn, learn about your child at that stage of time whenever you want. So if it's 2 a.m. and you're wide awake because you're feeding and, it's whatever, okay, come join us. You'll have some friendly faces, and it's the same for you. Like, you're up at, you, you bend over to pick up your child's toy or something, and your back went out. Okay, I can get help and relief right now by visiting Angela.
Yeah.
And that's too, like, how with the things I try to teach moms with the pelvic floor. And it's like, I like them to know that that doesn't have to be 45 minutes of exercise. Like, it can, but it doesn't have to be, and it can be every time you're like, how you're sitting in your chair and what you can think about while you're nursing your baby or feeding your baby. There are ways to connect with your body to help it feel good in a way that's fluid within your day and not so rigid of like, this is when I do this and I don't have time for it. And,
Yeah, definitely. Definitely. And that's a really great segue into, I love the module that you have on your program about, I can't remember what it's called, but it's like taking care of you so you can take care of your baby. And it's like all of those videos where you're teaching moms the proper biomechanics and like the proper ways to lift their baby, like how to hold them on their hip and changing sides, and like how to pick them up and how to do like the diaper change on the changing table and how to do them in the baby carrier. Like, all of that is such good information. And it's one of my favorite things about when I'm in the clinic, not whenever and sometimes whenever I'm on telehealth. But like, I love to talk to moms and say like, hey, what's your play space look like? What are you doing whenever you're on the floor with baby? Because a lot of times, like, play mats are right in the middle of the floor. And so moms are sitting crisscross applesauce on the floor with their shoulders rolled in and their spines hunched over, and
They get up and they're like, oh,
oh, what have I done to myself?
that one's called Save Your Body, Care for Baby.
There you go. Awesome. Thank you. Thank you for that. Yeah. So it's just like, that's great. Like, that's great stuff, because you can, like you said, you can work it into your day. You know how you need to engage your body, and the cueing that you give on some of the videos that I watched was phenomenal. I felt like I love listening to pelvic floor and like women's health therapists do their thing, because you guys are so good with cues and so good about making it like a whole body all day long thing, and not just like, hey, here's 45 minutes, go do squats.
Yeah. I mean, having somebody do that, same as like having somebody do Kegels, which is not, I mean, not that you shouldn't do them, not that I've never given them, but that is not like, that is like 10% of it,
Right.
you know? And if that's all you're given, like that's probably not going to help you get back running if that's your goal, or help you with prolapse if that's your goal or whatever. But yeah, I mean, it's kind of like, how many squats should I do to fix my knee pain? I was like, well, I don't know that answer. Like that might not even be what you should be doing at all. Like
Mhm.
that might not be appropriate, or, you know, helping you move better. Like that's going to be a far better use of your time. And then, yeah, sprinkle in how to engage the pelvic floor maybe later. Like that's not even where I go first, because I like to make sure that you're moving really well first. You know, especially if I'm working with, in my elite coaching, if I'm working with a client, more one-on-one, it's like, let's make sure you're moving really well first. And then everything else might just kind of fix itself. And then we'll sprinkle in Kegels or contracting the pelvic floor, like if we need later, but let's make sure you're bending really well, and that you're standing better, and that you have good rotation through your pelvis and your hips, and make sure your feet can move really well. And all these things that are kind of maybe outside the box of what maybe most providers or even most women think of as like pelvic floor therapy.
Yeah. Yeah. It's such good stuff. Right. And I'm loving, and I don't know maybe if this is like a regional thing within the States, but I'm kind of loving where women's health PT is going, because I'm hearing more and more, especially now that I'm older and like at childbearing age and have friends who are married and having kids, like I'm hearing more and more about, oh yeah, I was referred to pelvic floor PT like even before I had baby. And
That's a good provider.
I know it is a good provider. It is. And I'm like, yes. And I have friends who are, um, I have friends who are, maybe are PTs, but I have one friend in particular who is a geriatric specialist, right? So she doesn't know like anything about pediatrics, so she doesn't know anything about women's health. And I dabbled in women's health a little bit at my last job, because there's a big patient population just because of who the therapist was. She was known very well in the community. And so I was given the cases that didn't need internal work before I switched over to full-time peds. And so it's like, I loved that this friend in particular approached me and said, hey, I don't know any other pelvic floor therapists. And I know that you're peds now, but like, what should I do? And I told her, I said, just ask, like, go to your OB and just ask for the referral. And she did, and they gave it to her. And so she went pre having baby and she went after having baby. And it's just like, it's so awesome to hear that we do have these providers within the community that are kind of moving in that direction. But I also think, and you can speak to this too, that there's a lot of work that needs to be done. And that's kind of where we're at in the peds world too, is that these pediatricians are like, there are some who are awesome and great, and they're referring whenever they think they need to and whenever they're seeing things early. But then we also have pediatricians and providers and whatnot who, like what Rachel was saying earlier, they use that wait and see method. And it's just like anything. If you wait and see, you're spending more time in that motor pattern that's not optimal for whatever it is that you're working towards, whether you're a kid who is hitch crawling, you're solidifying that motor pattern. Or if you're a mom who is hinging their hips out to make a, right, yeah, or like to make a shelf for their baby to sit on, like they're just continuing that poor movement pattern. And you know, we just find that wait and see just isn't the right answer, and we need to educate families so that they know how to approach these conversations in a way that pediatricians are going to listen to them. Rachel, I think you had something you wanted to add.
Yeah, I just wanted to actually ask Angela this. I mean, you kind of touched upon it a little bit ago, but so it sounds to me then that any woman of childbearing age that's considering becoming a mom should possibly seek out or join your course, Angela, to get strong and prepared. And I have a question though. What about if a woman isn't able, isn't able to conceive? Is it still is she still benefiting her body by learning how to sit correctly or move correctly or work on her pelvic floor? Like, are all of these things, can it be bigger than, I guess, the target of just a mom that's just given birth?
Yeah. So in my programs, I specifically speak to moms, right? In terms of like, this happened while you were pregnant, but if you can look past that lens, if you can kind of ignore that verbiage, then it's appropriate for any person really, because all people have pelvic floors. Even men have pelvic floors, but I speak to moms, but that's only because I wanted it to be more relatable, right? Like with the Save Your Body Care for Baby and pregnancy specific things. But there's 8 different programs in there. And so like I have people that are in there that are in their 50s, way past, having kids. But this is all still applicable. And personally, I had pelvic floor problems, not maybe knowing that they were pelvic floor problems. In college, I ran collegiately. And whenever we would have a hard run, like a hard practice, I would basically pee my pants, like, or at 1 mile, we'd have to, I'd always have to pee at 1 mile. And now I know, like now knowing what I know now, I know that I was a type A personality, super rigid, like with my coursework for college, but also just like I overtrained, I didn't train correctly, like all of these things I know now. But at the time it was kind of this joke, like Angela has a small bladder. And I just kind of went along with it, I guess, because like, what else am I going to do? Like, I don't know.
Right. Yeah.
Like,
You're 20 years old, and it's like,
yeah, like
okay, well, I can either
And
go
you want
along
to
with
run.
this, or, I can be embarrassed by it. And like, I want to run because I'm a driven collegiate athlete.
right. So I just kind of went along with it. It was just kind of a joke. And that was fine, but it didn't feel great. Like when
Right.
I would go running, and then now I'm married and my husband had to pick me up, like, because I peed my pants completely out running. Like I had all these problems pre-baby. Right.
Mhm.
So like I had an upregulated pelvic floor. I didn't have symptoms. I didn't have like back pain or painful sex or those other things, but I had stress incontinence, urgency. Like I was the person that would have to, you didn't want to go on car trips with me for sure. Like it was like every hour, so that's kind of what stemmed everything for me to learn. Right. And so then now I'm pregnant, and it was the worst. Like, I think I thought I was doing the right things, but then, like the sharp lightning crotch pain kind of thing, or the sharp jolts a side joint where my leg buckled. I remember one evening, and I'm working, I'm a physical therapist. So like I was outpatient at that point. I had already transitioned to outpatient. But just like I'm fit, I'm exercising, I'm like doing the things that I think I should be doing. I don't know what my pelvic floor is or what I'm supposed to do with that, because I was not a pelvic floor therapist. But
Mhm.
in
Right.
terms
And they
of
don't
like,
teach us that in school, right? It's like, oh, hey, by
right,
the way, here's this. You'll learn more about it if you want to later.
yeah, like, no, if you're working in my brain, this is just me now. if anybody is working with somebody that has hips or a back, you should know about their pelvic floor.
Mhm.
And you should know that it matters, especially if they are not getting better, if their hips or back pain is not getting better with like traditional stuff, it could be a pelvic floor problem.
I'm sure for a pelvic floor, like if you were to do the program and you are confident in what you're able to do with your own body based off of Angela's cueing and the videos that are provided, like that's a much more affordable option than saying, hey, I want to do 10 cash-based visits with a physical therapist. Now, that's definitely valuable. I mean, I'm not like, I am a PT. Please go see a cash-based physical therapist if that's what you want to do and you really feel like that's what you need. But if you're just in a space of life where it's not in the budget or you don't have the time, like, man, these programs, and Angela, specifically your program for moms in general, I mean, I can see, and I see it through your testimonials too, that it's a life changer.
And it doesn't have to be one or the other. It doesn't have to be this or
Right.
that. It could be a combination of some combination of the two.
Yeah.
It could be that right now, if you are, I don't know, like a year out or less than a year out from baby, like maybe time wise, financial wise, like all the different just like barriers of like nap schedules, like to get to a therapy clinic, right? Like whatever the barriers are, like maybe it's more feasible for you to do the membership where you get access to really great information. There's still a support group. You still can access me with questions. It's not one-on-one calls, but there is the elite coaching as well, if that's something that you're wanting to do. But either way, like a really great affordable place to start. And then you're that much farther ahead to either combine it while you're seeing another physical therapist, because now you can like move forward.
Mhm.
You know what I mean? Like at your own pace, or supplement with questions. Like that's what I think is really great, because you can move forward at your own pace. And then when you do go to see somebody, you can be like, I learned
Why
this
don't I squeeze my
thing.
glutes to get up from a squat?
Yeah,
That's
I
my
learned this.
Like, might I add, I didn't know that. I mean, I've been practicing for almost 6 years now, and I have been told that I under initiate my glutes. And so, like, somebody somewhere in the chain of whoever I've been in contact with has said, Amber, you need to do that butt squeeze at the top of your squats because you don't use
What
your
do you do,
glutes at
Angela?
all.
What do you do?
No. Oh, right. What do? You squeeze your inner thighs.
Right?
I like to
Yeah,
talk about
you
it.
put a block, you put a
Yep.
block there while you're doing a squat and you squeeze your inner thighs instead. I mean, it just
And
makes so much
what works
sense.
better? What works better than above the knees? It usually works better if you do it below the knees. It just
Oh,
usually stays better. It stays
okay.
better. So right below the knee, hold on to something like a banister or a door frame. No, not a door frame. Well, you could do a door frame, but a door handle works really well, because then the door is like here, and then
Mhm.
it's kind of acute and not bonk your head, because you have to think
I
sit
love that.
into your tailbone space.
Yeah.
And you need lots of abs.
Yeah.
People do not use enough abs in general, typically.
Mhm.
People do not use enough abs when they're doing squats. Like they'll
Mhm.
just totally have no abs
Yeah.
and
Turn them
that's where you get the little
completely off.
shove the butt back, and you get the big butt wink at the bottom, and like a
Yeah.
small butt wink is probably okay. But making sure that you have those inner thighs. Don't drive your knees out. It
Right.
drives me bonkers when people throw bands on the outside of the knees, the circle band. You see it
Yeah.
all the time in workout
Yep.
programs
Mhm.
on YouTube and all the places, like, because you want to get strong glutes, you want to get the big booty. And so they'll just throw the bands on the outside of the knees
Mhm.
or thighs. And what's that doing? It's just driving your knees more open. It's just making you more shovey and grippy in your poor bee stinger.
Yeah.
I
Right.
love it.
That's
And then,
yeah, I am. I'm like
and then
making mental notes to add this to my weekly my weekly workouts, because like right now I'm trying to work on disengaging my upper core and engaging my lower, because I definitely have, and I've known this for quite some time, right? But I have an overactive upper core. And so whenever I do my core workouts, It only gets sore right underneath my rib cage. And
Oh, I have ideas.
oh, give them to me.
Yeah. So cupping cups can work really well.
Ooh, okay.
Silicone cupping cups.
Yep.
You buy them pretty cheap, inexpensive off of Amazon, $20 maybe.
Yeah.
So you suction those like right underneath. So do this maybe before. So you might be like an upper ab gripper, especially moms when you're holding baby a lot, like you can kind of get that compressed sternum, that like upper ab gripping. And so then your diaphragm there can get really tight.
Yeah. And then it
So
changes your breathing patterns, and it's like
all
it
these
just
things you have to
messes
work on.
everything up.
Right. So what you can do is maybe when you're laying on your back, or even just when you're sitting, go ahead and just take those cupping cups and just, you can do it in the shower. That's where you probably don't need lotion, but otherwise put lotion on there and then suction it right around. I'm just going to show you my belly. Suction it right
This is what I
around
love.
here.
This is what I love about PTs. We're all just like,
Okay.
let's look.
Yeah. Or I'm kind of the stretcher girl right now, but you could also just grab your skin and pull.
Yeah.
Okay. And then the same effect, right, as the cupping cup, or just you using your own hand. And this is a PT strategy, right? So skin rolling, really, really great.
Yeah.
Especially if you are somebody that has that big evident crease here. So you just grab that and then breathe into it. So you're taking that breath right into this space here. So now my diaphragm sits here all the way around my rib cage. So I would take a very soft breath in through my nose. And I like to have people visualize that there's a straw going right there. Like picture this imaginary straw going right there, or, I'll use that straw analogy other places too, but imaginary straw going right here. I'm going to take that breath. So I'm breathing into that tight space. So that can help maybe turn off, like they're not really going to be off, right? Muscles are more like dimmer switches than on-off switches. But it's going to help turn it down so that when you go to do your ab workout, maybe they're less available. Like they're less like just ready to go.
Right.
Because
they've been,
you've calmed them down.
Calmed them down a little bit.
Is, if you're doing ab work on your back, so it kind of depends on the position, but if you're doing ab work on your back, if you're super tight, like if your back is already super tight, or if your chest is really tight, you kind of create this teeter-totter pattern of like bad, right? Like you're either here or you're here. And so just take it out, just take it away from your body. So this is where props come in. So I will have people use 2 pillows, usually more like 2 pillows. And so if you can imagine, like the pillows are staggered. So like you have 1 pillow for your shoulders, and then your head would be on 2 pillows. Does that make sense? They're staggered a bit.
Yeah.
So you're kind of
laying down, right?
Right. You're in this situation. I'm just imagining that you're doing ab exercises laying down on your back. I don't know exactly, but in this scenario, you would be doing ab exercises on your back. So then if you're kind of elevated, you're taking that away from this teeter grip, right? And now put your hands, when you're doing your ab work, put your hands here and continue to think, like breathe into this space. And then in through your nose always. And then I like to have people think about their pelvic bones, like you are hugging. You have to do it.
And that's, and that's why that's
you have to hug
kind of, that nice, right. Yeah. You're like kept trying to pull everything back together. How important it is as moms and caregivers that we take care of ourselves, because if we're taking care of ourselves, then we can offer our best selves to our kids. And that's really what being a parent is about, right?
Yeah. I mean, you could say that Axel's like he is a very easy baby, but also I feel like this pregnancy and this postpartum experience, because of my past experiences, this has been like the easiest transition. And I feel like that has played a huge piece into how he is crawling actually, and how he is like an easy baby and like easy going. And I mean, he is the 3rd born, so that's kind of part of it. But I also think that when moms get to the point of you are having 3 kids, you are more chill, and you understand what to expect more. And so then that plays out into how that 3rd born child is more chill, but because of how you are as a parent, I think. But physically, even if you don't feel good or you're not sure what to do, like that's where just be an advocate or find the resources or sign up for my membership.
Yeah, for sure. I
And that is one
totally
thing that
agree.
we definitely hammer is you know, because there's certain things that I think a lot of modern parents do that may impact their child and their child's development. But at the same time, if you need that as a mom to just get through the day, you got to do what you got to do, you know? So no judgment, do what you need to do. But we do say that if you're noticing that every day you need to do these things, then you might need more support than you're giving yourself. So is that your mindset definitely helps your mood and your body though. So that's I think the biggest thing is that if you're in pain, you can't just go, "Oh, how do I make this more enjoyable?" You're in pain, your body hurts. So
Right.
that's the foundation. Like you've got to take care of your foundation. You've got to make sure that your body's mechanics are flowing well so that you can have a good foundation for movement, which is important, which is essential when you're a parent or just a human. You know, you've got to have good sleep. You've got to have good nutrition. So I think, you know, people talk about exercise as just, you know, oh, make sure you sleep well, exercise and whatever. But that's such a general, okay, great, you take a walk. But if you're walking and you're in pain because your hip's out or your back hurts or you prolapse, you
Mhm.
need specific support.
Yeah. And I think just to know that, very like in the programs, I talk about very practical ways that you can move through that, you know, and then to not to, yes, when you're in pain, when you're experiencing prolapse, when you're having bladder leakage, like all of that stuff is definitely going to catch your attention, but also to just come at it from a space of, and this is hard to do, but like come from a space of curiosity and, and try to not have the fear, right? Because if you think that your body is broken and you're like, I have prolapse and all these terrible things are going to happen and I need surgery and I have, you know, your mind spirals, your breathing's going to spiral, you're going to further go into that hole. But if you can know that like your body is resilient, you are 100% resilient, even if you have prolapse, even if you're 5 years out, even if like you completely pee your pants when you go run, like you just have no bladder control, it is going to be okay because you are resilient. And if you only look at, and this is why I love the way that I work with clients, is like, if you're only looking at the pelvic floor, then you only have this narrow window of opportunity. But if you're looking at your foot pressure and you're looking at your pelvis position and you're looking at how your ribs move and where your head is and where your tongue is, like if you're looking at, and that's not to be overwhelming, but if you're looking at all these other opportunities, now you have a lot of opportunities to move forward versus feel stuck and to feel like this is how it has to be. Does that make sense?
Yeah.
Cool.
Thank you
All
so much, guys.
Yeah.
Yeah, this is super fun. Well, you have a beautiful rest of your day.
Yes, thank you.
Okay, bye,
Yeah.
Angela.
Bye.
We're so glad that you could join us to listen in on that conversation we had with Angela. If you are interested in following her or learning more about her, go ahead and give her a follow on Instagram and check out her website. All of the information is right here. We look forward to seeing you next time for our next Ask the Expert. In the meantime, comment below with your questions and don't forget to hit that subscribe button. From all of us here at NewDay, have a good day.